comments from our many viewers who are participating
Uh,
live in this live stream titled Remote Gawayne.
Remote. Okay.
Yeah. So we're looking forward to our viewers' comments and questions because they're going to tell us why you're remote or ask. We'll see. So people watching this after the live production, this was live for a live audience. There will be
At
people
one point.
watching
Oh,
and
there we go.
communicating with us through their apps and whatever to make little chat comments during the live stream.
All right. Yeah. I'm trying to see if I'm trying to make everything work here. I got everything in front of me. Yeah, I am at home. So this is the first time we've tried to do this this way. So we'll see if it works out.
Yeah,
Um,
it looks to me like it's working. So I'm just waiting
I don't
for
see any comments though. That's just what I'm worried. I want to make sure that we get some comments coming up. So
yeah,
if
the
you're
comments.
hearing us and there, make a comment so we can.
We do have a lot of viewers, but we need the viewers
Excellent.
to ask us or to tell us why you are remote and not here in the office. Why we're
That
actually
is
able.
that is the big question, huh?
It's ironic that we're able to have this show without masks for the reason that we're able to do it.
Right. Well, hey, there's some things coming in. Bianca and Lindsay Antwine are both here and both saying hi. So
Okay, good.
that is good. So we're getting some
Welcome,
comments.
Bianca. Welcome, Lindsay. I hope you're feeling better, Lindsay.
Oh, is she not feeling well?
Well, it wasn't
think I
her.
knew
There
about
was
that.
a death in the family, so that was
Oh, yeah.
yeah,
Well,
had a
sorry to
bad
hear that.
weekend.
There we go. Now they're all popping up. I think we got this all figured out then. So
Yeah.
um, yeah, let me
So are there any
make sure.
are people guessing why you're remote?
No, just everybody saying hi. So we got Bianca, Lindsay, Robert Antonio, Teresa Roat, Suki M, all the
Oh
usuals,
man,
and Amber Foley as a first timer. Hey, thanks for showing up,
this is a
Amber.
great group.
So,
A lot of those
yeah.
are real regulars. I think Antonio, he's a recognized name, just isn't here every time.
Uh,
Yeah.
yes. Well, thanks for joining us. And we're doing things a little differently. So one of the things is you can actually see our facial expressions for the first time in a while.
It's been a while. Yeah.
It's sad that we had to do it this way. But hey, you can see us. So there's still nobody asking why.
They're not asking why we're remote or why you're remote, why you're not in the office here.
Oh, Deborah Ronker says, I have telemedicine with home health nurse. How
Yeah.
are you doing? Telemedicine. I did a fair amount of telemedicine today.
You've been
That's
doing a
how
lot
I
of telemedicine today. That's all you've
I
done
tell
today.
my patients. Yeah.
But
So
nobody knows why.
nobody knows. So yeah, this is a different background for me because I'm not at the office.
No, just telemedicine. And we miss you.
Oh, thanks. Appreciate it. Yeah, I
But
miss
I'm
being in
I'm
the office
glad that
too.
you're not in the office this week. I I
Why
would
would that be?
yeah, yes. Why is that? During a COVID-19 pandemic.
Why would somebody
Come
have
on,
to
viewers.
stay at home? Any
Do we
guesses?
have to spell it out for you?
Bianca says, I figured, Amber Foley, I figured maybe he's on quarantine possibly. And Bianca says, I'm waiting for you to say why. LOL. Yeah, so you would be correct. I am on quarantine. So I am at home uh, because I actually have COVID. So
There it
it's
is.
not just an exposure. I actually have a positive test. My test was done last Thursday, and I got the result on, I think it's late Saturday night that it came back positive.
Yeah. After
So
testing on, you said Thursday, right?
Thursday, yep.
Yeah.
So I have to stay home for 10 days, and I'm just going 10 days from the positive test, even though I had some mild symptoms before that. I'm going to wait a whole 10 days after that test, so I won't be back in the office till next Monday. So
Sounds
we got a
like you're
whole another
assuming
week.
that you'll be 24 hours with no fever and
Yeah, I am
improving
assuming that.
symptoms.
So,
Yeah.
yeah. Bianca says I'm diseased. Thank you for that one. Appreciate it.
Diseased.
Yeah.
Not at ease. Feel at ease.
Yeah, I feel a little bit like typhoid Mary here.
Yes. So we did notify your patients you saw Friday morning because that would have been within
Right.
2 days of the getting the test or the onset of symptoms, I guess I should say.
Right. And I was still safe. I believe all those patients should not be worried. I was wearing my double mask, my mask and my face shield. So I washed my hands multiple times with each patient before and after. So they should be fine. There should not be any exposure there. But to be safe, I am staying home. That is the recommendation. So
yeah, I'm glad you are. I'm glad we have telemedicine. So we're able and I'm glad we have this setup too, so we're able to do the show.
Right. Yeah. So I guess I'm happy to take questions on what coronavirus is like, even though I'm having a very mild case. So
I have a question.
I don't know how much I can.
Do you think that you got it from a patient at work or a coworker?
Oh, that's a great question. No. As with most cases of COVID, mine was a household transmission.
Okay.
So it was not a patient exposure. It was different. So my whole house is quarantining together, and fortunately, only a few of us have symptoms, and they're all fairly mild.
Oh, well, I'm thankful for that.
So Amber Foley says, "How are you feeling? Can I ask what your symptoms are?" Absolutely. So I feel fine, I guess. It feels like a pretty severe cold. I woke up with pretty bad nasal congestion. I've been having some body aches here and there. The really weird symptom is the losing taste and smell. That's a fairly common one from what we've heard and seen of people who have COVID. And it's tough to describe what that's like. It's tough to drink some coffee and not have that coffee taste, or you have something that you think what the taste should be, and it's just not there. Like, what did I have for lunch? I had some tangerines, and there was no acidic taste to them. It's like, taste essentially has become texture and memory. It's really weird. That's kind of the really, just weird symptom. Sorry, setting things up here so I can make sure I get the question.
So does it decrease your appetite? Do you not want to eat as much?
Not based on having COVID. I just don't want to eat because there's no point in eating if you can't taste, right?
Well, that's kind of what I was thinking.
So I mean, I had lunch just because I know I need nutrition. I definitely didn't look forward to it. I'm not one who really eats to taste any. I mean, I enjoy food, but I'm not one who gorges on stuff just because it tastes good. So. So I looked at food at my lunch and said, okay, I need a protein, a carbohydrate, and maybe I'll eat those two things that fit into that category. So that's kind of how it went. So that's a really weird one. Haven't had any shortness of breath, no respiratory symptoms per se, just the congestion. The body aches are not that bad yet, but those may get worse. So I'm still able to work and function.
No shortness of breath or cough?
No. Mild cough. Very mild. It was really weird to have a cough drop and not taste anything. Usually has that strong menthol taste. Nope, it wasn't there. It was just sucking on a cough drop. Be like this weird thing that had no taste.
What about really hot, spicy foods?
That was weird. So I did have some
I
had some Mexican food that had some hot sauce on it, and you could feel like the heat, like something was happening in my mouth, but I didn't like it wasn't hot. It's hard to describe.
It's like there's a party in my mouth.
It's like, but I can't. But it's like I don't know. I guess you could maybe describe it as hollow, like it's only a shell of what it is eating. It's kind of sad for somebody who. If I was somebody who really enjoyed food and enjoyed eating it, I mean, this would be really distressing. So, I don't know how long that's going to last. For some people, they're saying it's short-lived. Other people say that it can go on for a month. So I hope not. Like, that would make eating not that fun.
Yeah.
Bianca says to eat something bad like vinegar, see if you can taste it.
Thanks, Bianca.
Guess that's worth trying.
So you can get a bunch of sores in your mouth.
Eat something so bad that it gives me all these aphthous ulcers. No thanks, but I'm not gonna try that. Let's see here.
Thanks for suggesting.
Yeah, appreciate that. Praying for a quick recovery. Thank you.
Yeah.
Appreciate all the niceties that you guys are saying. I appreciate that. I feel fine. Like I said, it's not horrible, but I'm hoping that it continues to stay like this. And in 10 days, I'm feeling better. Have not had any fever, so I'm not too worried about that at this point. Let's see. Suki says my niece had that symptom also. I guess the lack of taste.
Yeah.
It says it doesn't come back, and it's been over a week since she's been better. Yeah, some people, like I said, some people say it's hangs on, which I'm not looking forward to that if that's the case.
No.
Are you increasing in supplementation of any sort? I think that's probably asking if I'm doing any vitamins or anything like that. No, not really. There's the research shows us that it doesn't really help. So I am eating a healthy diet, getting fruits and vegetables and the normal stuff that I do.
So you're not taking steroids or inhaled steroids?
No, and no vitamin C,
antiviral
no zinc, nothing like that. Nope,
Okay.
I'm not. I am very mild, and nothing is recommended for mild outpatient. I did take some Tylenol. I guess I should say that. I had some body aches, so I had some Tylenol for that. But that's about the only medicine. Oh no, tried some not Sudafed, diphenhydramine, Benadryl, just because I was having some difficulty sleeping and some nasal congestion. So I said, that's safe. I'll try that.
Okay.
Help me sleep a little better. Didn't do much for the nasal congestion.
No.
Clove oil. Oh, thanks, Bianca. Your suggestions are wonderful.
Clove oil. I guess
I didn't have
it won't smell or taste bad. So
I guess, yeah. It's it would be interesting to try any of those weird things. Let's see. Let's pray that stays the mild symptom. Yes, thank you for that. Appreciate it. So, that's gonna catching up on all the comments there. So
you're, let's see, if this is Monday, you're 2 days into it now.
Well, my positive test was Thursday, so I'm more than that.
Into symptoms though.
Symptoms. I had some very mild symptoms on that Thursday when I got tested. That's why we did that test to double check. I had this little tickle in the back of my throat. But yeah, symptoms really started to come on maybe Saturday. Yeah, okay. Saturday I started to have more nasal congestion and some occasional body aches. Yeah.
And then we need to know, do the viewers, do you want us to do this looking directly forward, or should I look at Dr. Gawayne and as I listen to him speak?
Oh, am I to your, do I need to look this way? Hey.
Yeah. So does it look like we're having a conversation with each other? I don't know.
Maybe.
We'll
but then I can't look at all their wonderful comments. I wouldn't be able to see that. Yeah. Well, when you watch the news, the anchor's always speaking directly into the camera. So
yeah, when they're doing interviews like this,
we're like.
But maybe we're a step ahead of them to think of that, though. I doubt they haven't thought of it, but
yeah,
or maybe maybe
they don't know
monitor off to one side.
It's gonna be. Yeah,
I could do that. I could totally do
that. Bianca says forward is fine.
Forward is fine.
I think people like when you talk to them anyways, like we're talking to the viewers. So we're talking to each other and to the viewers. So
okay.
I feel comfortable looking directly into my camera.
Okay. And normally I go back and forth from you to the viewers.
Bill Gree says impersonating the Brady Bunch. Yeah, that's kind of what they did. Looking at that.
Oh, yes, that's right. Looking down, looking up.
That's right. Yeah. Wow.
Wait, that would make me. Well, I could have been 3. I could have been Alice. I could have been
on the right side.
Let's see. Alice was right in the middle, and I don't remember where the parents were. Wait.
Yeah, people say talk forward. That seems to be the general consensus here.
Okay. Okay.
Stop looking to the side.
Okay.
It's freaking people out.
I'll stop looking over there.
Yeah, somebody asked if I had a fever. No, I haven't had any fevers yet, so that's good. And the rest of my family as well. We just all been exposed, so we're quarantining together. And they've all had mild symptoms. My wife had a little more symptoms. My kids are fine. No, not really any symptoms. My one son who tested positive had a fever for a couple days, and then he's been fine since he's doing school from home, like all the rest of my kids. So
Okay.
Somebody asked, did you have the PCR test? Yeah, we probably should talk about that, how the testing went.
Yeah. Tell us about that.
So at our office, we have both the rapid antigen test and then the send away PCR test. On Monday, as soon as I found out I was possibly exposed, I went and had a test that was negative. So the recommendation is if you have a negative test, and that one was done at the ER, they have a rapid nucleic acid amplification test, which is a PCR-based test. And that one was negative. So I was reassured about that one. And then on Thursday, when I started to get some symptoms again, we did a rapid in our office and it was negative. That's why I continued seeing patients. But we did a send away just to make sure. And now we've done a little, investigation into that antigen test. And I guess you can probably talk a little bit about that.
Yeah, I looked at the insert on it and found that in their testing of it, the manufacturer of it, they did not find that it missed any positives. So that if you're positive on that test, it's very, very, very likely that you really do have COVID-19. And so that's why we stop right there if somebody's positive. But if somebody turned out to be negative on the test and they compared it to PCR, sometimes they would be positive on the PCR. And in fact, in our office, our experience has been 4 out of 11 negatives turned out to be positive on the PCR. So if you are negative on that rapid antigen test, it is recommended to isolate until you get the results of the PCR test.
Yeah. So that's what happened in my case. I had a negative antigen test and a positive PCR test. So let's see, Deborah Runker, you guys are great and very hilarious. I enjoyed the time when I stopped by to be. Oh, thank you. Appreciate that. Yeah, that was nice to have somebody, one of the fans, stop by.
Yeah.
Anybody else?
I just saw Deborah's pictures.
Don't do it this week because I won't be there. And don't stop by my house because we're currently quarantining.
Yeah.
We're having everything delivered and we're like writing in the thing, just drop it off. Don't knock. Don't do anything. We don't want to expose anybody.
Did you come by our house this weekend and pick something up off the doorstep?
I did.
So didn't even know it because we stayed inside.
I don't think you were there. I think you were on a hike or something when I did that. But
I think we did go on a hike.
Yep, and I was not gonna knock anyways.
Saw a red-shouldered hawk.
Oh, really?
Yes. Got a picture of it this time.
Oh.
Even with a phone on a camera. I'll have to show it sometime.
Okay. I'll check that out.
Yeah.
Let's see. Bianca says, I have a cold sore and my gland is swollen. Hope it's not a sign of COVID. Well, I don't think those are specific signs of COVID. Cold sore can be a sign of, a impending infection, but not necessarily COVID. So it's not a specific sign to COVID for any of
very non-specific.
Yeah. So I would not, and hopefully you haven't been exposed. Hopefully you've been, isolating like most of us should. So yeah, the tough thing is, my family, we were pretty diligent about wearing masks. No, not pretty. We were very diligent about wearing masks.
Somebody else wasn't.
Whatever we went out. Well, yeah, my son, of course. And then he was with somebody else who was not diligent about it. And that's how it happened. He's in the family. So we are a close family. And of course, everybody got exposed. So
that's how it happens.
Bleach the doorstep. Yeah, that's what Bianca says. I think she's talking to you.
Yeah.
I think. Let's
see. How long does it live on cement? I think it's dead now.
I bet it's pretty short-lived.
Yeah.
So, Amber Foley is from Illinois. She wouldn't be able to stop by. Oh, that's good.
Good.
And not good that you're not able to stop by.
Not now. And when they send all the stuff in the mail to you, wipe it off, clean it off.
What stuff? Who's sending stuff in the mail?
Well, if they're sending food to you.
Oh. Yeah. Well, I don't have anybody sending me food. They're all dropping it off. But
you were in the office to learn about the COVID cake, right?
Oh, yes. Oh, the COVID cake story.
The COVID cake.
Oh, man.
How'd
that turn out? Did that test come back yet?
I, I
I hadn't heard. I guess
I
maybe
don't
we
have
can.
knowledge of that, but yeah, we'd like to
Okay.
find that out. Yes.
Yeah.
So
The COVID
this
cake.
year may not be the year to eat anything that somebody brings by, especially if they don't bring it themselves because they were feeling sick and had somebody else give it to you after they made it for you. Probably
Yeah.
don't want to eat that,
Right.
as good
So,
as it may taste.
yeah,
Okay, I've said too much already.
individually wrapped. Even then, you
Yeah.
probably don't want to do anything. Yeah.
Yeah.
Which is a bummer because we
Well,
always look forward to that during the holidays.
I guess we just need to look up how long can the virus live on different types of
Just
cakes.
set it aside for that long. Then it's not going to taste but good. So we can only eat stale cake. Is that what you're saying?
I don't know how long. It,
Yeah, I guess we'll have to.
it's not going to be fresh. I'll say that much.
Let's see here. People, we are as diligent as possible. This is Bianca. We're diligent as possible, but it's hard when kids are college and university, and we'll see my mom. Yeah, there are people that The tough thing is, well, let's just say it this way: your bubble is probably not as small as you think it is.
Yeah.
um,
Yeah.
so the way that it happened in my family, it was a distant, not distant, but a relative. And now every person that's seen that relative has been exposed, and we were just getting positive tests like crazy. My whole family, pretty much, and then other people within my family, and then of course they're having to tell their friends. It's just that bubble expands so quickly
Yeah.
that really, even with close family members, you need to be
Yeah.
diligent. Even not even just close family members, but if anybody who you're coming in contact with. So
Yeah. And when it comes to those people who are especially vulnerable because of their underlying conditions and age, tho- those exceptions that you make with it getting more and more prevalent are more and more
right.
likely to result in a severe
Yeah,
illness.
and we've been going at this for so long now that all of us are getting that fatigue of having
Oh,
to
yeah.
mask up every time we go out, and even when we're around, maintaining our distance. And it's been a year almost now, so I can understand the difficulty of maintaining that, but
Hmm.
it's just going to keep getting worse if we don't. So we need to
Yeah.
do our best. Um, Amber Foley asks, how long does the virus last on surfaces? Could you guys shine a light on that for me?
Depends on
Like
what the surface is made out of.
That's
Um,
right. Yeah, it's different based on
some
type of
things
surface.
3 days, some things shorter, some things longer.
Kind
Um,
of I think it seemed like plastics, harder surfaces, it can last longer on, if I remember. But yeah,
yeah.
it can
The
be
CDC
persistent.
has a page that shows different surfaces and how long it
Right.
lasts.
Yeah. Was cakes on that? How long does
I,
it
I was
last on
trying
a
to
cake?
think of what would cake be most like? The stainless steel, the plastic? Yeah, that
Depends
was
who
tough.
baked it. Mine may be more like a stainless steel than say someone else.
Okay.
Um, Maybe we should give people an update of where we're at, as far as cases and just the
Oh
numbers.
man.
They're going
So
crazy. I bet people probably know, but
yeah,
even out of our office just last week, we saw a exponential rise
yeah,
in the cases we were diagnosing.
yeah,
So I
yeah.
don't know if we've had any more today. I
We don't
obviously
usually
wasn't there.
have more than one a day, and that's what we're doing now out of our office in
Right.
our town. And
Yeah.
so, that's every day somebody goes positive is in. Usually it's outside. Usually it's the drive-by, through the
Right. Yeah, where we've
driver's
had
side window
minimal
type
exposure.
testing, most likely. But
Right.
thankfully for the rest of the office. But yeah, we sent as many people out as we could. Not just you, but we have other office personnel and MAs who were saying, "Hey, let's get you set up to work from home instead of bringing you into the office for this
Right.
week." And then just have the office set up for those people we have to have in to avoid sending them to the emergency department or urgent care, because they're
Right.
overrun or have the potential for it.
Yeah. Um, yeah. It's just been going crazy. So another interesting thing, I got contacted by a contact tracer today. I found that an interesting conversation. So now I have actually been a part of that. I didn't know Placer County was doing it, but apparently they are.
So that was for your positive COVID test, not for something else.
Yes, that was not
Okay.
anything else. I know where you're going with that, but we'll keep that an inside joke. No, just kidding. Um, so she kind of went through all the questions. It was a phone call. So this was like I've been saying before, that with as many cases as we have, it was a good 30-40 minute conversation going through everything that she had to ask me.
Oh my goodness, it takes that long?
So yeah. So I know if you go back to one of our previous videos where we had a nice little debate about whether or not we can actually do it well. This goes more towards, no, we can't keep it up this way. We need to do it more the way that you were talking about, with the app that automatically traces and tells you who you've been exposed to. So yeah, it's definitely not sustainable the way that conversation was done and having people do it.
Yeah, I don't understand why we're not making more progress on it. The app exists. There's places in the country that use it, and other parts of the world. Yeah, I'm kind of blown away by that. As far as personal information or invasion of your rights, I would think shutting down your business is much more concerning than an app that actually doesn't tell anybody else where you are. It's at least not connected with identifying information. I guess people are paranoid that it's not what they say it is, or something like
that. Let's see. Just going through the questions here.
Did they ask you for contact information for the people you were around that you knew you'd been with?
Actually, no, which I found interesting because my positive test, they didn't ask me like who my patients were, which I couldn't give them anyways. But I told them that I let her know that I had already kind of done my own contact tracing and let my business know so they could contact the patients and kind of let all my family know. Mm-hmm. So I don't know if that's why she didn't ask me that, but I really haven't come in contact with many people either. So
they're not going to be calling me?
Maybe just as my employer, but or somebody I work with, but not as.
Okay.
No, I don't think so.
Okay.
Yeah. So, I'm looking at that. Some comments here. I think it's somebody, Suki, is saying that if you have a family member who's an essential worker, your bubble gets really big. Yeah, that is true.
As we've noted, although you didn't get it from work, you got it from.
You're right. I did not get it. I was diligent, and even going into businesses and wearing my mask, I'm confident I didn't get it exposed that way or expose anyone else. I'm confident of that. Let's see. Probably due to Thanksgiving. We're about a week out from Thanksgiving.
Although your contacts are really before Thanksgiving, right?
Right. Yeah, ours happened before. Yeah. But then that individual did have a Thanksgiving with some family members who are now, some of them are testing positive. So
after the initial contact happened, our families, including our kids home from college, we actually went on a hike together.
You're right, we did.
Wearing masks.
Wearing masks.
And I don't expect that we're going to get anything from that because you guys probably weren't shedding virus yet at that point.
I'm pretty confident that we were all fine. Yeah. That was definitely before I had anything.
But even if you were wearing masks, we were wearing masks, we were outdoors.
Right.
We really weren't within 6 feet that I remember, maybe passing each other briefly, but that was still outdoors.
Right. We were pretty good about wearing the masks, even when people were yelling at us for wearing masks outdoors.
I just remember that one guy with the dog.
Yeah, he was pretty upset about us wearing masks while we were outdoors.
He was very upset. There may have been some emotional issues there.
Yeah.
Something else.
Yeah. So, let's see. The vaccine's almost ready to go out, says Bianca. That's true. We're this week, actually, we're gonna, at least here in the States, we're gonna be getting hopefully some clearance and even some initial vaccinations going on.
Yeah, we still have not been notified how we are going to get it, or our office staff. I'm
Yeah.
actually more concerned about the office staff because I think there's ways I might be able to get it that they can't because of being on staff at the hospital.
Right.
So I'm
Yeah, that's true.
really wanting to get our office personnel taken care of.
Yeah, we definitely need to figure out how that's going to work because all of them are exposed just as much as we are. So, I guess Bianca's saying that the NHS workers are getting the vaccine next week. So it sounds like a similar plan to what we're doing here, which is great.
Yeah, they had an approval earlier than ours will happen. Ours will, at the earliest, happen on the 10th. But I think as far as actually getting it to people, it'll probably be very similar because we've had all of this logistics already being worked out and delivering of the virus going out before the approval, so it's ready.
Yep. Yeah. So that's exciting. I guess that's still on the horizon, and we'll see where that goes.
Yeah. Just trying not trying to count too much on the timing of it because, it may be February before we're done and vaccinated.
So somebody may be wondering that even though I've been infected now and am building up immunity as we speak, am I still going to get the vaccine? The answer is yes, absolutely. I'm still going to get that vaccine. Not only to be a good example for my patients, but I will need it still because the response my body's making, it shows that that's just not going to last. And we need to boost that in any way we can, and hopefully a vaccine can do that for me. So, here's my take on that.
Is that it for comments?
Let's see. Yeah, Lindsay Antwine says she eats because it tastes good. So you don't want to get COVID and lose your taste. When things don't taste good and you're just eating textures, it's not that exciting. It loses a lot of its fun. That's about it. And it looks like one of the things that I need to make sure is my computer's dying. So we probably
you're starting to break up. So
it in.
Must be at the end of the show
all day. So yeah, it's time.
Thank you, Dr. Gawayne. I'm so sorry that this happened to you. Thank you for seeing patients by telemedicine, and thank you for doing the show by telecommunication also.
Of course. Yep.
Anybody you wanted to thank?
Yeah, I appreciate it. You guys can definitely go over and check out Dr. Green Knight. I had a queued up one. I'm definitely going to write about my experience with COVID in the future, but today's was just more dictation errors, which people always seem to love. So I want to thank Teresa Rollout and Boo Boo Kitty for that. Appreciate you guys supporting that.
All right. And I also want to thank Boo Boo Kitty and Lindsay Entwine. Until next time, this is...
Hey, I'm Dr. William Bond.
And Dr. Mark Bond telling you.